Don't blink. There are new deadlines, programs, and money on the table all the time. I know it's hard to keep up, and that's why I'm here to do it for you. This is your can't miss update for April 2024. One major change could mean more money in your pocket. Let's talk about a major change coming to SSI this year. If you or someone you know relies on this program, you need to know about this because it could make a real difference in your life. Now, we all know that SSI is an incredibly beneficial program that can provide up to $943 for an individual or $1,415 for a couple every month, right? You probably also already know that you have to meet strict income limits to qualify, usually under around $1,900 a month. But what you may not know is that little things like a bag of groceries can count as income under the current rules. That's right, getting help with essentials like food can actually hurt your SSI benefits. That's because when someone gives you free groceries, the Social Security Administration counts it as income, potentially cutting your monthly payment by up to a third. That is a huge impact, and it's all because of something called the in-kind support and maintenance rule. This rule counts things like food or shelter as income because they are used for your support and maintenance. It's really annoying, really tedious, and really complicated for everyone involved. But there is good news. You can mark your calendars for September 30th because that is when the Social Security Administration's new rules will kick in. These rules will completely remove food from the in-kind support and maintenance rule, which means that you can get help with food assistance from friends, family, churches, charities, all without worrying about your SSI payment shrinking. That means you'll be able to keep more of that money for your other essentials, bills, and unexpected expenses that always seem to pop up. This is a big deal because it's going to make life a lot easier for those of you who rely on SSI. It's also going to help others because it means that the Social Security Administration will stop wasting time trying to track every time someone hands you a banana, and they'll be able to spend their time on more important things. And because this will drastically simplify the rules, they will also be able to issue more accurate payments. The best part, though, the Social Security Administration has announced that this is just the first of many more announcements to come. They said they plan to issue more rules this year that will help SSI recipients, so of course I'll be watching that closely and I'll keep you posted on any new updates that roll out. Now, speaking of updates, we have received a major update on something I told you about recently. This is how the Social Security overpayments will be handled. I know I covered this in depth a few weeks ago, but there is one important clarification that we need to address today. If you are currently in repayment for overpaid Social Security benefits, you have to reach out to the Social Security Administration to renegotiate that payment amount. The new Social Security Commissioner, Martin O'Malley, has said that their previous policy of taking back your entire check to repay old debts was cruel, and he's right about that. So instead, he said that the Social Security Administration will now only take up to 10% of your check to pay back those old debts. That means you could reclaim hundreds or even thousands of dollars a month if you've lost your benefits due to an overpayment. However, and this is the part we need to talk about, this does not happen automatically. You have to file a waiver or call the Social Security hotline at 1-800-772-1213 to request a lower repayment rate. The new default is 10%, but you can request a lower percentage as long as you'll be able to fully repay your debt within 5 years at that lower rate. Now, if you do decide to call in, make sure to give yourself plenty of time. The Social Security Administration is currently very understaffed. I think I read that their staffing levels are at a 27-year low. News outlet 11 Investigates found that the average wait time is over 60 minutes, but you can request a callback instead of waiting on hold that entire time. Now, another alternative is to reach out to your elected officials in Congress. They can often cut through bureaucratic red tape for you and make the process easier. This was mentioned in at least one of the articles I read, but I also know it works from personal experience because I've contacted my Congress people for help with VA issues before. It is surprisingly effective. You can find the names and contact information for your elected officials by searching your address at congress.gov. Now, if you've lost Medicaid in the last year, please listen closely to this next part. In some states, more than 80% of people who lost their Medicaid benefits were wrongly removed. This is happening nationwide, and you may still be eligible for those benefits. Here are some things you should know. Over 19 million people have had their Medicaid benefits taken away, and many were wrongly removed due to paperwork issues, even though they were still eligible. Some states were especially harsh. In Nevada, around 93% of people who lost their benefits were removed for paperwork reasons. In Georgia, it was around 84%. It's crazy. Some states removed more people than they kept. In Utah, 57% of people who were getting Medicaid were kicked off the program. Isn't that wild? Now, here's the thing. A lot of these people were and are still eligible for Medicaid coverage. They just missed something in the mail, or forgot to update their phone number, or made a little mistake on their paperwork. But a lot of these people do not know that they can reapply. In Idaho, more than 20%, that's more than 1 in 5, people who lost their Medicaid coverage have re-enrolled in the program and are receiving those benefits again. That is a great start, but there are others who may be eligible who haven't reapplied. So here's what to do if you've lost your Medicaid recently. If you're still within your appeal period, appeal the decision. You can request a hearing. It is your right. Second, if the appeal period has ended, just apply again. You may be able to get those benefits, and they may even be retroactive up to 90 days. And if you are not eligible for Medicaid, but you do have children in your house, apply for CHIP. That's the Children's Health Insurance Program. It has a higher income limit than Medicaid does, and it may still provide health coverage for your kids. So whether it's Medicaid, CHIP, or another option, there could be help available to you. Don't give up on getting the health care you and your family deserve. Now, for those of you who definitely aren't eligible, the U.S. Department of Health and Human Services has recently announced that they are extending their special enrollment period to help people who have lost Medicaid enroll in a plan through the health insurance marketplace. This enrollment period is now set to end in, is it September? No, I think it's November 30th. I think I have that wrong in my notes. I apologize for that. So they've also rolled out some new guidance and tools to ensure that states are being fair. The new guidance provides tools to ensure states are doing this properly, and they also offer resources to help people navigate their Medicaid fair hearing process as well. Before we move on, I do want to remind you that time is running out to claim your check from the Verizon Administrative Charges Settlement. You may be owed up to $100 from the settlement if you currently have or have had a Verizon account for wireless or data services between January 1st, 2016 and November 8th, 2023. But here's the thing. You have to file a claim by April 15th in order to get a payment. I filed my claim months ago, and it only took a few seconds, so it's not as hard as it sounds. But if you don't file a claim and you don't exclude yourself, you get nothing, and you basically forfeit your right to ever sue Verizon about this issue. Don't let that happen to you. Go to VerizonAdministrativeChargeSettlement.com to file your claim or opt out. And on that note, our sponsor Injury Claims is available to help you file for Social Security, appeal a disability denial, or stand up for your rights against big companies. If you've been injured by certain blenders, developed cancer after using chemical hair straighteners, or experienced significant side effects after using Ozempic or Mounjaro, or if you qualify for one of their many other cases, they may be able to help you. Browse all of their open cases at lirlinks.com/claims. Now, this may be the last month that you receive a full subsidy through the ACP program. This program is expected to pay a partial payment in May, but it will run out of funding at that time if Congress does not act. As of the recording of this video, the program still has not been extended, despite having broad bipartisan support. There's a bill in the Senate, sponsored by Senator Peter Welch of Vermont, which has not been acted on. And there's another bill in the House that was sponsored by Representative Yvette Clarke of New York that has a whopping 221 co-sponsors. But it hasn't been acted on yet either. These bills are just sitting there, and so far they aren't going anywhere. This is an essential program that provides free and low-cost internet to millions of low-income households across the country. The good news is that there is still time for this program to be extended, so please reach out to your congressional lawmakers and urge them to take action on this. But even if it ends, there are other free and low-cost internet options that may be available to you. There were low-income internet discounts before ACP, and there surely will be again if ACP ends. You can see the full list of options we found at lowincomerelief.com/internet. Of course, that's not all that's changing in April. Please remember that tax season is wrapping up. Every year, nearly 1 in 5 eligible taxpayers miss out on the earned income credit, which can be worth up to $7,000 or more depending on your household size and income. If you think there's even a chance you may be eligible, please go talk to a VITA volunteer in your area before that tax deadline. Winter LIHEAP is wrapping up in most areas by the end of April as well. If you need help with your utility bills, please reach out to your local Community Action Council for assistance. Many spring programs, like the Senior Farmers Market Nutrition Program and the Double Up Food Bucks Program, are starting to open up in certain states. For SFMNP vouchers, you'll need to follow your area agency on aging. And for Double Up programs, you can visit lirlinks.com/doubleplup for a list of providers. Now, if you have any EBT-related questions, please drop them in the comments right now, because I'm working on putting together something awesome for you, and I need to know all the EBT and SNAP-related questions that you have. So, and if you missed those detailed resource roundups with all the juicy details about giveaways, programs, and freebies in your area, go grab a $1 membership to our channel and watch our latest members-only video, because it will show you step-by-step how to find those resources in your neighborhood. The membership link is in the description of this video. I'll see you there.